Have you ever wondered why cancer, in all its forms, continues to pose such a significant challenge to human health? Amid the myriad of diseases that humanity has come to know, cancer remains a prevalent and formidable foe. It's not just a single disease, but rather a group of diseases characterized by the unchecked growth of abnormal cells that can invade and destroy normal tissue. Cancer's reach is global, marking it as the second leading cause of death worldwide. Yet there's hope in this seemingly bleak landscape. Advances in screening, treatment and prevention have been steadily improving survival rates. From unmasking the genetic mutations that play a critical role in its development, to understanding the role of age, lifestyle choices and exposure to certain chemicals, we have come a long way in our understanding of this complex disease. Yet, the battle is far from over. Every discovery, every breakthrough brings us closer to a future where cancer may not hold the power it does today. Understanding cancer is the first step in the fight against it. Cancer originates from our own cells, albeit ones that have gone astray. This isn't a case of external invasion, but rather an internal rebellion. Let's delve into the process of how these once normal cells turn rogue, transforming into abnormal cells that can invade and destroy normal tissue. Picture a bustling city, that's our body. The cells, they're the citizens, each performing their specific roles to keep the city functioning. But sometimes something goes awry. A citizen, or in our case, a cell, begins to behave differently. It begins to grow and divide at an abnormal pace, ignoring the body's signals to stop. This uncontrolled growth and division is the birth of a cancer cell. But what causes these cells to go astray? The answer lies in our DNA, the blueprint of life. Genetic mutations, errors in our DNA, can cause cells to function incorrectly. These mutations can be inherited, passed down from our parents or acquired, resulting from damage to our DNA over time or due to exposure to certain harmful substances. For instance, consider the role of a traffic light in our bustling city. It controls the flow of traffic, ensuring order. Similar to this, our genes control the growth and division of cells. Now imagine if the traffic light malfunctions, chaos ensues. Similarly, when mutations occur in these genes, they may fail to control cell growth and division, leading to the formation of cancer cells. It's important to note that not all mutations lead to cancer. Our bodies have mechanisms to repair these errors, but sometimes the damage is too extensive, or the repair mechanism itself is faulty due to a mutation. In such cases, the outcome could be a cancer cell. These cellular culprits, once normal cells, can wreak havoc on our bodies. They grow and divide uncontrollably, forming a mass known as a tumor. These tumors can invade nearby tissues and spread to other parts of the body, disrupting the normal functioning of our city. The once orderly and harmonious city is now in chaos, all because of a few cells that have gone astray. Cancer often whispers its presence, with symptoms varying depending on the affected body part. In this clandestine game of hide-and-seek, cancer plays the elusive antagonist. The symptoms it manifests are as varied as the types of cancer themselves. A silent alarm that often goes unnoticed. Breast cancer might subtly announce its arrival with a change in the shape or size of the breast, or a lump that wasn't there before. Lung cancer might stealthily sneak in with a persistent cough or shortness of breath. Colorectal cancer might quietly creep in with changes in bowel habits or blood in the stool. Each type of cancer has its unique set of symptoms, its own silent alarm bell that rings quietly, often drowned out by the cacophony of everyday life. But these symptoms are not just silent alarms, they are also our body's way of communicating with us. They are messages encoded in the language of discomfort and change, asking us to pay attention, to listen. As we navigate through the labyrinth of life, it's easy to ignore these whispers, these subtle changes. But in the realm of cancer, these whispers can be life-saving. The importance of recognizing these signs cannot be overstated. They are the first line of defense, the early warning system that something is amiss. Ignoring them can lead to a late-stage diagnosis, drastically reducing the chances of successful treatment. On the other hand, paying heed to these silent alarms, acknowledging their presence, and seeking medical advice promptly can lead to early detection. And in the battle against cancer, early detection can be a game changer. Listening to our bodies and recognizing these silent alarms can be the difference between early detection and late-stage diagnosis. So let's not ignore these whispers, let's listen to these silent alarms. Because in this game of hide and seek, finding cancer early gives us the best chance of winning. While we cannot control our age, we can certainly influence other risk factors for cancer. Age is indeed a significant risk factor, with the incidence of cancer generally rising as we grow older. The biology behind this is complex, but it's believed that as we age, our cells accumulate more genetic mutations, some of which may lead to cancer. But age isn't the only player on this field. Our lifestyle choices play a pivotal role too. Consider smoking, a notorious contributor to lung cancer, amongst others. The toxins inhaled while smoking can damage our DNA, increasing the likelihood of abnormal cell growth. Then there's excessive alcohol consumption, which can also lead to several types of cancer. Alcohol can act as a solvent, making it easier for harmful chemicals, like those in tobacco, to enter cells. It can also damage the liver, leading to inflammation and, in some cases, cancer. But what about harmful chemicals in our environment? They're everywhere, from the air we breathe to the water we drink, even in the food we eat. Prolonged exposure to these carcinogens can damage our DNA and increase the risk of cancer. A classic example is asbestos, which was widely used in construction until its link to lung cancer and mesothelioma was established. And then there are certain chronic health conditions that can increase the risk of cancer. For instance, those with a history of chronic inflammatory bowel diseases such as Crohn's disease or ulcerative colitis are at a higher risk of developing colorectal cancer. Similarly, those with persistent infections such as hepatitis B and C or human papillomavirus, HPV, are at an increased risk for certain types of cancer. While the list of risk factors is extensive, the good news is that many of them are within our control. We can make choices that reduce our risk, like quitting smoking, moderating alcohol intake, maintaining a healthy weight, and getting regular exercise. We can also limit our exposure to known carcinogens and manage chronic health conditions with the help of healthcare professionals. By understanding these risk factors, we can make informed decisions to reduce our chances of developing cancer. Knowledge is power, and in this case, it could very well be the power to save our own lives. Cancer's reach extends beyond the disease itself, leading to various complications. This statement rings true for many who have experienced the disease firsthand. Cancer is not just a physical ailment, it's an insidious invader that can bring about a host of complications, some of which can be as challenging as the disease itself. Let's delve into the physical impacts first. Cancer and the treatments designed to combat it can lead to a myriad of physical complications. These can range from fatigue and pain to more complex issues such as nutritional deficiencies and immune system suppression. The body, in its fight against cancer, can sometimes bear the brunt of the battle. Then we have the emotional toll. A cancer diagnosis can be a devastating blow, often leading to feelings of fear, anxiety, and depression. The emotional roller coaster doesn't stop there. The journey through treatment can be filled with highs and lows as hopes rise and fall with every medical report. Cancer also has societal impacts. The disease can affect a person's ability to work, leading to financial strain. Relationships can be tested as loved ones grapple with the reality of the illness. Even after recovery, cancer survivors often face discrimination in various aspects of life, including employment and insurance. The impact of cancer doesn't end with the cessation of the disease. Long-term survivors may experience late effects of treatment, such as heart problems, second cancers, and cognitive issues. These late effects underscore the need for lifelong monitoring and healthcare for cancer survivors. It's clear that cancer's reach is far and wide, touching every aspect of a person's life. But it's equally important to remember that help is available. Medical teams, support groups, and therapists can all play a crucial role in managing these complications. Addressing these complications is a key part of comprehensive cancer care. The fight against cancer is not just about eliminating the disease, it's about supporting individuals on their journey, ensuring they have the resources they need to navigate the challenges that come their way. Preventing cancer may seem like a daunting task, but there are practical steps we can all take. Indeed, these steps might be simpler than you think, and they all revolve around one central theme: taking care of yourself. Firstly, maintaining a healthy lifestyle is key. This involves a balanced diet, regular exercise, and keeping stress levels in check. A diet rich in fruits, vegetables, and whole grains, along with lean proteins, can go a long way in keeping your body strong and resilient. Regular exercise not only keeps your body fit, but also boosts your immune system, making you less susceptible to diseases. And let's not forget the importance of mental well-being. Chronic stress can weaken your immune system, leaving you vulnerable. Therefore, it's essential to find healthy outlets for stress, such as meditation, yoga, or even a simple walk in the park. Secondly, regular screenings cannot be overstated. Cancer often develops silently, with symptoms appearing only in advanced stages. However, with regular screenings, it's possible to catch the disease early, dramatically increasing the chances of successful treatment. Screenings can vary based on factors such as age, gender, and family history, so it's crucial to discuss this with your healthcare provider. Lastly, it's crucial to avoid exposure to carcinogens. These harmful substances can be found in tobacco smoke, certain chemicals, and even some types of radiation. Being aware of these substances and taking steps to limit your exposure can significantly reduce your risk of developing cancer. Remember, the power to prevent cancer lies in your hands. It's about making conscious choices every day that contribute to your overall health and well-being. It's about listening to your body, getting regular checkups, and making decisions that respect and protect your health. Every step we take towards prevention is a step away from cancer. By embracing a healthy lifestyle, staying vigilant with regular screenings, and limiting exposure to harmful substances, we can all play an active role in our own health and significantly reduce the risk of cancer. It's a journey, but it's one well worth taking. Knowledge is power, especially when it comes to our health. It's crucial to understand that cancer is not just one disease, but a collection of diverse diseases, all characterized by the uncontrolled growth of abnormal cells. Each type has its own unique set of symptoms, risk factors, and prevention methods. Understanding these nuances can significantly impact how we approach our health and wellness. Staying informed about the latest developments in screening, treatment, and prevention is vital. It's not just about reacting to a diagnosis, but being proactive in reducing risks. In the grand scheme of things, maintaining a healthy lifestyle, getting regular screenings, and avoiding exposure to known carcinogens are among the most effective strategies. In this age of information, it's easier than ever to arm ourselves with knowledge. Let's use it to our advantage to protect ourselves and our loved ones. Let's not underestimate the power of prevention and early detection. Stay informed, stay proactive, and take control of your health. Remember, the fight against cancer begins with you.